Hello and welcome to my YouTube channel. Today I'll be speaking to you about the reasons why you should see a doctor if you've got a headache. If you haven't watched the video on when I discussed different types of headache, particularly tension type headache and medication overuse headache, I'd encourage you to do that. You could do that after watching this one anyway. Now, essentially, headaches can resolve spontaneously, even without treatment. Sometimes they require simple analgesics such as paracetamol, and you'll be doing well. I mean, you don't need to see a doctor. However, there are situations where you need to see a doctor. The doctor you need to see could be a general doctor or a neurologist. That's a specialist that deals with nerve-related issues, particularly the brain and spinal cord, nerves generally. Number one, we've said that headache can be caused by so many conditions, ranging from high blood pressure, malaria, typhoid, diabetic emergencies such as hypoglycemia. In other words, hunger can cause headaches. And then you could also have meningitis, glaucoma, giant cell arteritis, form of vasculitis, and sinusitis. However, there are situations where the headache may occur in association with some other manifestations for which it's important a doctor's attention is sought. So I'm just going to go through them very quickly. Number one, if you've got a headache alongside jaw claudication, in other words, you've got pain in your jaw when you chew, it may not just be a tooth problem. It may require you seeing a doctor because that could be a presentation for giant cell arteritis, which is a form of vasculitis. I've done a video on that. If you'd want to watch that, I'll put the link in the description. If you've got visual disturbances such as double vision, or for some reason you've got severe pain when you look in the direction of light, it's important that you see a doctor. If you've got heaviness, numbness in your limbs, upper or lower limbs, it's important that you see a doctor. If you've got headache alongside pain in the scalp, in other words, just a simple touch around there can elicit pain, it's important that you elicit tenderness. Of course, the patient calls it pain. We call it tenderness when we examine. It's important that you see a doctor. If the headache is associated with sleep disturbances, in other words, you go to bed, you know that for some reason you snore excessively, and then by the next morning, in the course of the day, you have daytime sleepiness alongside headache, please see a doctor. If the headache is associated with vomiting, please see a doctor. Could be a sign that there's something like a space-occupying lesion, a brain tumor occurring. And that's not to say that every time somebody has a headache and vomiting, it's a brain tumor. I'm just giving an example. Could be as simple as malaria. Of course, when I say simple, it doesn't mean you shouldn't get adequate care. Fever and neck pain. If fever, neck pain in combination with headache, please see a doctor because that could be the presentation for meningitis. Of course, if the headache is not relieved by use of analgesics, it could either mean that there's something going on that simple analgesics are unable to handle, or could this be a case of medication overuse headache or analgesic headache or rebound headache? I've explained this in the previous video. It could also be due to raised blood pressure. As much as we say that high blood pressure could present without manifestations or symptoms, we're also aware that headache can be a presentation in raised blood pressure. And then if there's lacrimation, in other words, alongside the headache, there's tearing and there's rhinorrhea, in other words, secretions coming from the nostrils, please see a doctor. If you have these that I've mentioned alongside headache, it's important that you see a doctor. Thank you for watching, and I hope you subscribe before leaving. Bye.